Hello and welcome back to Unacademy platform. So let's crack NEET PG. Myself, Dr. Muskan Chaudhary, and today we'll be discussing the leftover images from the microbiology. As we know that Unacademy is India's largest learning platform, we can assess both the live and the recorded sessions and anywhere and everywhere by the topmost educators who are working day and night to prepare the best of structured courses for you guys. And you can compete in live tests and discussions and can assess the MCQs that are up to 25,000 plus MCQs, high yield MCQs, clinically oriented with effective explanation, and can study on your this device. Exclusive chance of watching your classes on a bigger screen. Right, soon printed notes will be coming, but if you are taking the plus subscriptions before 11th of September, so plus subscription with along with it, you will get the printed notes. But once after 11 subscriptions, the printed notes will be available only with the iconic subscription. The PrepLadder has come together with the Unacademy, and PrepLadder is, as we know, it's a very famous coaching institute and learning platform for the NEET PG aspirants, especially the rapid revision courses and the snapshots of the PrepLadder. So you can watch the video lectures and the rapid revision courses from the PrepLadder, along with you can practice from the high yield MCQs and the topics from the Unacademy platform. So both the platform has come together and collaborated to help you guys for your preparation for the NEET PG, right? So, all those students who are in the medical college and are still in the second year, third year, I will recommend to have 4 year subscriptions, 4 year subscription, so that it will be very economical, cheap compared to other online coaching platforms or offline coaching platforms. And for 4 years, it will cost you around 60,000 only. And for Iconic, it will be 70,000 rupees. And along with this, 12-month subscriptions, 2 month subscription is totally free, and for 14 months 24-month subscription, 4 month subscription is totally free, right? And please do use my code, that is Muskan 10, to get the 10% discount, right? So after applying 10% discount, it will amount you to about 40,500 for 1 year, right? That is equal to 3,375 per month. Okay, so so if you found any error in the content, you can let us know and pin the exciting offers and the prices. Okay, now coming to the first image, that is coming to the first image. Now, what is this and what type of colony formation you can see? So you can clearly see yellow colored colony formation on the nutrient agar. Okay, golden yellow colored colony formation on the nutrient agar, and this is seen where in Staphylococcus, because Staph shows the golden yellow colored colonies on the nutrient agar due to presence of the beta carotene pigment, or it is also known as STX, that is pigment, that is beta carotene pigment that provides the golden yellow colored colony to the nutrient agar. So this is nothing but the staph aureus that is showing the golden yellow colored colonies on the nutrient agar due to presence of what, the beta carotene pigment or styloxanthine pigment. Now, when we talk about the Staphylococcus shows the culture on the nutrient agar as golden yellow colored colonies, and on the blood agar is the beta hemolysis. Please remember, it shows the beta hemolysis on the blood agar, right? And mannitol salt agar, that is the selective media that we use for the growth of the Staph aureus. Okay. Now, when we talk about the staph, this is Staphylo, or yes, as we know, it is catalase positive. Please remember, very important, because on the basis of the catalase test, we differentiate the staph and the streptococcus. That one is the positive. Another C is that it is what, coagulase positive. Okay. Just now we saw that it is what, beta hemolytic, right? And it is has the enzyme that is the phosphatase. thermonuclease, DNAs. Okay, so staph consists of what? It is what? Catalase positive, coagulase positive, beta hemolysis will shown by the staph, and the phosphatase thermonuclease, and the DNA is positive. All right. Now this is what this is. This is mannitol salt agar. Okay, this is a selective media for what? The Staphylococcus, and the salt that is present in the MSA is selective for the growth of the Staphylococcus. Okay, and when the staph will grow on the MSA, the colony formation will show what? Yellow colored colonies. Okay, and wherever the color of the colony is changing, it will be what? It will be example of also the differential media as well. ठीक है, तो MSA selective media तो है और differential media भी होगा क्योंकि it is changing, showing the color change to that of the yellow. ठीक है, and what was the indicator in the MSA? It was phenol red. Phenol red is the indicator, and we need to remember the indicators of the differential media. Now, what is the another selective media? This is a mannitol salt agar. We have read about this. Salt is used for the growth of the selective growth of the this Staphylococcus. And what is the another selective media apart from the MSA? That is what? Utlands media. ठीक है, तो स्टैफ में हमने क्या देखा? कैटलेज पॉजिटिव, कोएगुलेज पॉजिटिव, बीटा हेमोलिसिस, फॉस्फेटेज पॉजिटिव, right? Thermonuclease and the DNA is positive. And what are the selective media? That is, one is the MSC and another is the Luteolins media. That is what the selective media for staph. Now, the food poisoning due to meat and the milk products, due to contaminated meat and the milk products, will have an incubation period of what? 1 to 6 hours. And this incubation period is what? Similar to that of the incubation period of Bacillus anthracis. That is similar to what? Similar to the incubation period of Bacillus anthracis. Now, these are again what? These are either present in the dimer form or they are what? Clustered form, because Staphylococcus, the cocci are present in the grape-like form. Cluster form is the gram-positive cocci in the cluster form. Again, the beta hemolysis. Now, one more thing we need to remember is that the mannitol salt agar. This is again the mannitol salt agar. That is the color change of the media. In the Staphylococcus, you can see the yellow colony formation. Toxins we have read about, enzymes we have seen. Toxins that is consisting of what? The alpha toxin, beta toxin, gamma toxin, pantovilletine toxins, two exfoliative toxins, and eight enterotoxin and TSST. Now, the last three are what? Super antigens. We know this ki super antigens, the staff में one was the toxic shock syndrome toxin, one was the entero, and one was the exotoxin. ठीक है, so these last three are examples of what? Super antigens. Now this is what this is. As you can see clearly, some bubble formation. The test is showing the positive. This is nothing but the catalase test, and it is very important test because on the basis of the catalase test, we differentiate water, Staphylococcus and the Streptococcus. That is the presence of water when the breakdown of the H2O2 by the presence of what? catalase takes place will result in the oxygen, okay, release of the oxygen, and this will show the bubbling. You can see. This is again the same, the catalase positive and the catalase negative showing the bubble formation because of the presence of the catalase that is breaking down H2O2 into H2O and O2. Now, one more thing we need to remember is that key, although they are what the coagulase positive also, but when we talk about the coagulase negative, okay, what are the examples of the coagulase negative in the staph? That is Staphylococcus, Saprophyticus, and Staph epididymis. Okay, so although it is catalase positive, coagulase positive, but there are exception in the staph itself. Is coagulase negative. The examples are the staph, saprophyticus, and epididymis. And the saprophyticus cause it was the UTI, and staph epididymis is what novobiocin positive. It is novobiocin. Is novobiocin sensitive, while it is novobiocin what resistant. Okay. So remember this, that it is catalase positive, coagulase positive, but coagulase negative staph is what staph saprophyticus and the epididymis, and this staph epididymis is what novobiocin sensitive. And how we remember this mnemonic? By no stress. That is novobiocin resistance is what the staph saprophyticus, and epididymis is what sensitive. Now coming to the next, that is this nothing but clearly you can see chain like foci that are stick together. You can clearly see this is nothing but the streptococcus that are gram positive foci arranged in chains. This is again showing the beta hemolysis by the streptococcus. But we need to remember that streptococcus, all the three types of hemolysis are shown. It is alpha, beta, and gamma. Alpha hemolysis, beta hemolysis, and no hemolysis. That is alpha showing the partial green hemolysis that is shown by the Streptococcus pneumococci and the Streptococcus viridans. Okay? And beta hemolysis, that is the beta hemolysis, beta say B, that is the group B Streptococcus. They are showing what the beta hemolysis and what are group B, that is Streptococcus pyogenes and Streptococcus agalacti. And the gamma hemolysis is easy, that is non-hemolytic, that is the Enterococcus. Okay, so alpha, beta, and the gamma hemolysis, we are talking about alpha, matlab partial, and the green hemolysis. And what are the examples? That is the streptococcus. You can easily remember it, LVP, that is viridans and the pneumococci. Beta may group B, pyogenes and agalacti, and enterococcus, that is the gamma. That is the gamma hemolytic or no hemolysis is shown by the enterococci. Right, this is the streptococcus pyogenes we are talking, and pyogenes and agalacti will show the beta hemolysis on the 5 to 10% of the sheep blood agar. Now, what is this? It's a very famous test for the Streptococcus, that is what it is, CAM test. Okay, and it is shown by what the group B, Streptococcus, that is Streptococcus agalactiae. Now, when we talk about the group A and the group B, when we talk about the alpha, beta, and the gamma hemolysis, ठीक है, तो gamma में तो no hemolysis था, alpha में viridins and pneumococci, but beta में group A and group B comes under the beta hemolysis, and group A consists of what the Streptococcus pyogenes and group B of the Streptococcus agalactiae. Okay, so Streptococcus agalactiae, this is what CAM test positive and bacitracin resistant, जबकि Streptococcus pyogenes is what? Bacitracin sensitive. Okay, and remember it कि B के बाद C आएगा, that is A, B and C, that is A galacti in group B will show the CAMP test and bacitracin resistance. So remember it by the A, B, C of group B, that is Streptococcus A galacti of group B will show the CAMP test positive, and the Streptococcus pyogenes is what? CAMP test negative and bacitracin sensitive. Also, Streptococcus agalacti, it will cause what? It will cause early and late neonatal meningitis. ठीक है, तो Streptococcus agalacti will show what? Early and late neonatal meningitis, जबकि Streptococcus pyogenes will cause what? Pharyngitis, nasal fasciitis, and the scarlet fever. ठीक है, scarlet fever, fasciitis, and the pharyngitis. ठीक है. Okay. Now, moving next is that this is a CAM test. We know we read about the CAM test की मैं करते कि staff का one inoculation of the staff, longitudinal inoculation of the staff is done, and staff will already show the beta hemolysis we have just read out. And also when placed down the group A, this A is showing the Streptococcus agalacti. जब अपन we will place inoculate it will show an increased zone of hemolysis at the point of the interaction. Okay, this is the point of the interaction. It will show the group, this Streptococcus agalacti will show the increased synergistic effect of the beta hemolysis and will show a arrowhead colony, and this is nothing but the CAM test. Right, and it is positive in the ABC, that if you remember that Streptococcus agalacti of the group B, Streptococcus will show the CAM test positive. Now this is what, this is again this is nothing, this is again test that is done for the streptococcus, and it is what? The bile esquilin test. This is what? Bile esquilin test. Now, bile esquilin test, for what group of the streptococcus we do? It is actually done for the group T streptococcus, where we do the bile esquilin test, and it will show the black colored colonies on the bile esquilin test. Okay. Now, why only the Streptococcus D will show the bile aspirate test majorly is because of the group D. When we talk about the group D Streptococcus or the Enterococci, they are one point that we remember is that where they are gamma hemolytic, that is no hemolysis will be shown, right? And they are resistant to high pH. They grow in 6.5% of the NaCl, right? And they need 40% of the bile, and they can grow in temperature up to more than 45 degrees Celsius. So they actually resistance to high pH, 6.5% of NaCl, 40% of the bile, and temperature more than that of the 45%. 40 degrees Celsius. Also, they are what resistant to vancomycin, and therefore the drug of choice is what the linezolid. Okay, so drug of the choice is the linezolid and the gamma hemolytic group, that is the group D streptococcus, enterococcus faecalis, and the faecium. It will show what positive bile esculin test. The black colored colonies on the bile esculin test. Now, because esculin present in the media actually utilized by what the beta this group D streptococcus, causing what the brown black color of the media. Now, this is nothing but the Thayer Martin media, that is what Thayer Martin media, or the Fuller's Hilton agar with 5% of the chocolate sheep blood. So this is Thyromartin media, or the Muller's Hinton agar with 5% of the chocolate sheep blood agar, that is used for the growth of what the meningococcus. Okay, that is used for the growth of the Neisseria. Okay, for the growth of the Neisseria and the meningococcus and the gonococcus. Now, what is this? You can clearly see the lanceolate appearance. Okay, you can clearly see the lanceolate appearance of what? Of Streptococcus pneumococci. Okay, that is the for the Streptococcus pneumococci, and it belongs to which group of the hemolysis? Alpha hemolysis, along with the Streptococcus viridans. Now, what is the mnemonic that we need to remember for the Streptococcus pneumococci? That it is what? It is P biopositive. That is what the Streptococcus pneumococci is, what bile soluble, okay, inguinal fermentation, and the optogen sensitive. So it is what? It is P biopositive. That is pneumococci is what? Bile soluble, inguinal fermentation, and optogen sensitive, while viridans will be automatically optogen resistant. And what is the specific appearance that is shown by the Streptococcus pneumococci? It is nothing but Draughtsman appearance. Draughtsman appearance. Okay, as you clearly see, this is what elevation of the colony, and the appearance is known as the Draughtsman appearance. And also one more thing that you can clearly see, one, in the lancet appearance, you can clearly see the capsule around the Streptococcus pneumoniae, that is, they are what? Capsulated. And what were the tests for the to see the capsule? That was the Quillings, mainly we were using for the Streptococcus. That is a Quillings reaction. इसके अलावा मैकफार्देन reaction we were using for Bacillus anthracis, and the Indiana ink and the nigrosin we were mainly using for the Cryptococcus. And the capsule will be appear swollen and the refractor in the Quillings reaction. This is again the Doddsman appearance of what? The Streptococcus pneumoniae. Now this is going on the sheep, it show the Doddsman colonies, and it is due to what? The optogen, and they are, since they are optogen sensitive, they'll show a rim like elevation of the growth that is surrounded by the zone of the inhibition. Okay? This is surrounded by the zone of the inhibition, giving appearance of the Doddsman colonies. Now we'll talk about something that is we'll talk about the exceptions of the gram positive cocci, that is gram negative cocci, Neisseria meningitis, and the Neisseria gonorrhea. Now, one thing we need to remember is that Neisseria meningitis, you can see a thin rim around the, both are in what the paired form. A thin rim that is present around the Neisseria meningitis, that is they are what capsulated. They are what capsulated, and it consists of pili. You can clearly differentiate. That is the gonorrhea consisting of the pili. Now, when we talk about the shape, they are what mainly kidney shape. Okay? While they are what lens shape paired cocci. Okay? And also we remember this key that Neisseria gonorrhoeae only G is present, so only glucose fermentation. Jabki M, that is what mannitol and the both glucose fermentation. Okay, so Neisseria meningitis and Neisseria gonorrhea, that is pili formation that is present on the outer surface, pili that is present in Neisseria gonorrhea, jabki meningitis, it is capsulated, it is lens shaped, while Neisseria gonorrhea is what kidney shape, and it is what mannitol and the glucose fermentation for M, and G, that is only glucose fermentation. And also, the virulence, when we talk about the virulence factor of the Neisseria meningitis, that is Neisseria meningitis, what are the virulence factors? That is one is the IgA protease and the lipopolysaccharidase. Okay? That is IgA protease and the lipopolysaccharidase. And the selective media, we've already seen that it is the Thayer-Martin media. Now, when we talk about the complication, the most common complication in the Neisseria meningitis is what? Waterhouse Fredrickson syndrome, that is an adrenal gland failure. Okay, it is what? Waterhouse Fredrickson syndrome. How can we remember this? And it is M. Meningitis is M. उल्टा करेंगे तो W, that is the Waterhouse Fredrickson syndrome. And what is the complication that is present in Neisseria gonorrhea? That is urethritis and cervicitis, and it is the Fitz-Curtis syndrome. That is polynephritis. Fitz-Curtis syndrome. ठीक है, तो व्हाट वर द इंपॉर्टेंट पॉइंट्स? जी से जी ग्लूकोज होगा फर्मेंटेशन, वहां पे ग्लूकोज, एंड एम से मॉल्टोज दोनों. meningitis is capsulated and gonorrhea में पिलाई होते हैं, and it is gonorrhea is kidney shaped जबकि meningitis is lens shaped. And what is the valence factor of Neisseria meningitis? It is IgA protease and lipopolysaccharidase. What is the most common syndrome that is associated with meningitis? Is Waterhouse Fredrickson syndrome, that is adrenal gland syndrome, and Neisseria gonorrhea is urethritis cervicitis. And what is the syndrome? That is the Fitz-Curtis syndrome, that is the polynephritis. Now coming to the next slide, that is now coming to the next slide, that is what we are talking. You can clearly see these granules at the end in the shape of the V or the shape of the L. This is what? This is Corynebacterium diphtheria. What is the other name for the Corynebacterium diphtheria? It's the Klebs Loeffler's bacilli. Okay, what is the other name? That is the Klebs Loeffler's bacilli. And these are what? Nothing but the volutin granules or the Babes earnest granules or the metachromatic granules or polymetaphosphatase granules or the bipolar granules. ठीक है, ये सब नाम we need to remember that it is the Corynebacterium diphtheria or the Klebsiella bacilli with the volutin granules, Graves' earnest granules, metachromatic granules, polymetaphosphatase granules or the bipolar granules. And this is what this is. This is Loeffler's serum slope that is used for the growth of what? That is used for the growth of Corynebacterium diphtheria. Okay, so it is what an active media that is used for the growth of the Corynebacterium diphtheria. And what is the another solid media? This is the enrichment the media that we are using for the growth of what the Corynebacterium diphtheria. And what is the another selective media that we are using is the potassium tellurite agar, where they will show the black colored colonies. That is the PTA agar that we are using. Okay, and what are the stains that we are using to see the granules that are pan, that is Ponders stain, Albert stain, and the Neisser stain. Okay, the pan we are using for the staining of the metachromatic granules or the this bipolar metaphosphatase granules, that is the Ponders stain, Albert, and the Neisser stain. Okay, and also please remember that the exotoxin that is released by the Corynebacterium diphtheria is what? An protein inhibitor. ठीक है, तो किसको inhibit करेगा? Elongation factor 2 via this ribosylation of the elongation factor 2. And what is the test that we used to do for the to see the sensitivity against the Corynebacterium diphtheria is what? The Schick test. So these are some important points of the Corynebacterium diphtheria, that is Loeffler's serum slope is the enrichment media and the potassium tellurate agar is the selective media. Pan is used for the staining, that is the Ponder stain, Albert stain, Neisser stain, and oxytocin that is released is what? Inhibiting the protein synthesis via the inhibition of the elongation factor 2, and the Schick test is what? Used to determine the Corynebacterium sensitivity. Now this is what? This is nothing but the potassium tellurite agar showing what? The black colored colony due to reduction of what? Reduction of potassium tellurite. Okay. Now that is causing what? Reduction of tellurite to tellurium. Even if you do not remember, that is okay. Just remember the name of the media and the how does the colony appears. Now this is the pseudomembrane of the Corynebacterium diphtheria that may even obstruct the airways and results in the suffocation. And this is the bull neck that is seen in the Corynebacterium diphtheria infection. We'll not go into the detail of the clinical, how does it takes place. Just remember the bull neck and the pseudomembrane. This we have done yesterday only. So just name, I'll tell you what was it. Is what? These are what? The antibiotic disc, and this is the zone of the inhibition, and this is the AST test. And what is the name? It is the Kirby Boyer disc diffusion test, and this is used to check the sensitivity. And the garden, this lawn culture का नाम याद रखो. It is the lawn culture that is used for the inoculation of the bacteria. उसके ऊपर भी actually use the antibiotic disc, and generally we use the six disc one in the center, and from the zone of inhibition to the center of disc we measure the distance, and we see the sensitivity of the bacteria against what? Against the antibiotic. This is Kirby-Ward disc diffusion test. This is the abscillometer test. That is on the one side, एक साइड पे क्या है, on the one side it is a minimum inhibitory concentration, you can see these markings, और दूसरी साइड पे हमने बैक्टीरिया को इनोकुलेट किया है to see the sensitivity against the antibiotic, ठीक है. The microorganism is inoculated on the other side and the minimum inhibitory concentration on the one side, and the name is epsilometer on the shape, as you can see, Greek word that is the epsilon. So this is the again the garden culture that we have seen for the microorganism, and on the one side it is MIC, दूसरी side पे अपन एंटी माइक्रोबियल, नीचे की side पे अपन एंटी माइक्रोबियल यूज करते हैं. So this is the zone of the clearance you can see and similar to shape of the epsilon. So नाम पड़ गया epsilometer, और incubation overnight रखते हैं इसका. Just remember two important points. One side it is a minimum inhibitory concentration and another side it is a antimicrobial on the same strip. This we also did कल ही क्या था कि it is what gram positive or the gram negative. I'll just tell the key points. It is a gram negative क्योंकि चारों rings है यहाँ पे. That is a LP, MS and LP are present in the outer membrane. और outer membrane gram positive में तो होता नहीं है, तो therefore LP are not present in the gram positive. It is only MS rings that are present in the gram positive. Samples of the monotrichous, amphilopho, and the peri. We have seen last kali only कितनी monotrichous this Vibrio and the Campylobacter, this alkali genes, ठीक है, and the Lophotyphus is the H. pylori, and the Spiralium. Peritrichus it is E. coli, Salmonella. So these are few important examples. Just remember the techniques, that is the direct method में अपन Leifson's method for staining of the flagella, and indirect में Craig's tube, hanging drop motility, semi-solid media and the dark phase contrast microscope. This is what, this is nothing but this is what, this is the bamboo shape appearance you can see. Okay, the central spore, that is what the Bacillus anthracis, and it is what capsulated. ठीक है, और कैप्सूल बेसिलस एंथ्रेसिस में किसका बना होता है, पॉलीपेप्टाइड. we need to remember that it is the polypeptide capsule. And what was the reaction we was used to check the capsule, that is the Mac-Fadden reaction, and it was staining of the capsule is due to what, the polychrome methylene blue that we are using to stain the this capsule of the Bacillus anthracis. Okay, so this is again, this is the Bacillus anthracis, and this is what the Mac-Fadden reaction, and we can see what, the capsule appearing purplish due to the take the color of the polychrome methylene blue that is used to stain the what, capsule. Now, this is what, this is the string of pearl appearance, and where it is seen, string of pearl appearance. Where it is seen, this is again seen on in Bacillus anthracis. Okay. And what is the selective media that is used for the growth of the Bacillus anthracis is what, the plat media, that is what, the polymyxin lysozyme EDTA thallium acetate. So this is the selective media, and they show what, the pearl, string of pearl appearance, and what, string of pearl appearance, that is the cell becomes large and spherical, occurs in the chain of what, pearl, similar to that of the pearl. And plat is the selective media, and the composition is important. This is again same, this is what, this is क्या है ये क्या है? That is similar to that of the Medusa head. That is a Medusa head appearance. ठीक है, this is also seen where in the Bacillus anthracis. When the Bacillus anthracis grow on the media, culture media, they actually show the tailing at the end, similar to that of the Medusa head. So, given the name, that is the Medusa head appearance. This is again the string of the pearl appearance, that is by the Bacillus anthracis. Now, one more thing is that what is the disease that is caused by the anthracis? That is, one is either cutaneous or दूसरा is what the pulmonary. Okay. Now, if pulmonary, this will show what the pulmonary hemorrhagic mediastinitis, right? And for the cutaneous, malignant pustule formation, malignant pustule and formation of what? Eschar. Okay, that is both the cutaneous and the pulmonary. And in the pulmonary, what is the name of the disease? That is what the Foot-Sorter's disease. Foot-Sorter's disease, that is the pulmonary hemorrhagic mediastinitis or Wood-Sorter's disease. This is the plat media. We have talked about the polymyxin lysozyme, EDTA, and the thallium acetate. This is again what the pulmonary hemorrhagic mediastinitis and showing the mediastinal widening, also known as the Wood-Sorter's disease. Now, another is the Bacillus cereus. Now, Bacillus cereus is also Chinese fried rice, and the media is what the MYPA culture media, that is what the mannitol, yolk sac, polymyxin, agar. ठीक है, so MYPA is used for the growth of the Bacillus cereus and PLAD for the growth culture media for the Bacillus anthrax. And what is the incubation? We have already read, similar to that of the incubation of the staph, that is 1 to 6 hours, and mainly after consumption of the Chinese fried rice. Culture media we just read yesterday. We'll come to the rest of the questions. Okay, so we'll come to the now. What you can see here is that what is it with the terminal? You can one thing you can see is the terminal spore, and along with this, the questions, the clinical question will be given, or the history with some other points will be given. So we will talk about now about the closed tree. Okay, they are what? They are gram positive spore forming uncapsulated. ठीक है, although they are uncapsulated, but इसमें भी exception है that are what? Capsulated. ठीक है, that is PCB is what? Capsulated, that is Clostridium perfringens capsulated and Clostridium butyricum. Please remember, it is the PCB that is the capsulated, that is the perfringens and the butyricum, and they are gram positive spore forming. And one thing to remember is that they are what the obligate and aerobes. And what are the examples of the obligate and aerobes? That is the A, B, and C. That is the actinomyces, bacteroids, and what? Clostridium. ठीक है? Actinomyces, bacteroids, and what? Clostridium. They are what the obligate anaerobes. So they are gram-positive spore-forming uncapsulated and the obligate anaerobes. And what are the examples? ABC, that is the actinomyces, bacteroids, and the Clostridium. And PCB is capsulated, that is the Clostridium perfringens and the Butyricum. Now, before coming to this media, one more thing is that key spore, terminal spore, that is round in shape, one, and another is the terminal spore that is oval in shape. Okay, so terminal spore that is rounded shape is found in Clostridium tetani, that is the drumstick appearance, and it is found in the Clostridium tertium, that is the tennis racket appearance, and one is what the Clostridium obligate aerobe. What are the examples of the obligate anaerobe we have already seen. Now, one is what the central spore, that is the, we can easily remember center, that is the bifurcating, so it is Clostridium bifermentus. Okay, so terminal and the round spore that is found in the Clostridium tetani, that is the drumstick, tennis racket in the tertium, and the central that is bifurcating, that is a bifermentus. Now this is the Robertson cooked media with the beef particles, small beef particles. And what is the use, why we are using the beef particles? क्योंकि इनके पास glutathione है, that will cause the reduction and consumption of what the oxygen, creating the anaerobic media. Okay, so this is nothing but the Robertson cooked media that is used for the anaerobic media. Now this is what this is. You can see that this is the swarming growth of. Now when we talk about the swarming growth, we generally talk about the protease. Okay, that swarming growth is shown by what the protease. Lekin swarming growth apart from the protease is seen by the PVCS, that is the protease. V for Vibrio parahemolyticus, C for Clostridium tetani, and T4S, that is the Serratia. ठीक है, Serratia, and Serratia what gives the red color pigment. Please remember that protease, apart from the protease, the swarming motility is seen by the PVCS, that is the this is the protease, Vibrio parahemolyticus, C for Clostridium tetani, and the Serratia. This is what, this is the, क्या है ये, this is what, this is the Nagler's reaction. ठीक है, किसमें दिखता है? Clostridium perfringens. And another thing that is seen in the Clostridium perfringens is what the we need to remember is the target hemolysis. It shows both the alpha and the beta hemolysis, that is the target hemolysis, and also it what causes the gas gangrene. So these are three most key points, that is the Nagler's reaction positive, अल्फा एंड बीटा hemolysis, that is target hemolysis क्योंकि दोनों hemolysis present है, and gas gangrene. Now what are the other organisms apart from the that is also causing the gas gangrene apart from the Clostridium perfringens? One is the Clostridium perfringens and another is the Clostridium novi and the Clostridium septicum. They also cause what the, they also cause the gas gangrene, that is a perfringens, novi, and the septicum. And what is the another bacteria that also shows the Naglach reaction? That is the, that is what, please remember, it is Bacillus anthracis. Okay, a Naglach reaction is so shown by both the Bacillus anthracis and the Clostridium perfringens. And how do we differentiate these two? On the basis of the hemolysis. because Clostridium perfringens will show the target hemolysis, that is both the alpha and the beta hemolysis, and this is nothing. When the Nagler reaction is positive, we check out the lecithinase activity of the alpha toxin. That is one side, no antitoxin will be there in the media, and the egg serum containing media. This will be what showing the lecithinase activity by the Clostridium perfringens. This you can clearly see, that is the target hemolysis, that is one is this and another is this boundary. You can clearly differentiate this boundary. Okay, so target hemolysis or the double zone of hemolysis because of both of the alpha and the beta hemolysis. Now another when we come talk about is the reverse cam test. Also the Clostridium perfringens shows what the shows reverse CAM test. अब what is the difference between the CAM test and the reverse CAM test? CAM test हमने कहाँ देखा था? Group B streptococcus में, that is a streptococcus agalacti. So and what were we using the inoculation पहले? Staphylococcus, right? That was the CAM test. Reverse CAM test में हम क्योंकि Group B streptococcus को identify नहीं कर रहे उसको use करेंगे. This is the reverse CAM test. Only this is the basic difference. So what we do is that group B streptococcus, you can see group B streptococcus is first inoculated, that is a streptococcus agalacti, and perpendicular to it is a Clostridium perfringens, and Clostridium perfringens shows the alpha and beta hemolysis, and therefore a synergistic effect of the hemolysis will be present, and arrowhead hemolysis is clearly shown. ठीक है, सो ये क्या हुआ, रिवर्स कैम्पस दैट इज शोन बाय द क्लोस्ट्रीडियम परफ्रिंजेस. सो गैस गैंग्रीन, डबल जोन ऑफ hemolysis, and this reverse cam test. Now this is what this is. This is a smiling face, that is what the log jaw, ठीक है, and it is what the type of paralysis, that is the spastic paralysis. ठीक है, and what is the other name for the log jaw is what, Rhizus sardonicus. What it is? Rhizus sardonicus. Rhizus sardonicus, and it is the lockjaw, and it is type of paralysis is what, the spastic paralysis. And what is the another one word, that is the opisthotonus, that is also seen in the Clostridium tetanus infection, and incubation period is about 10 days. Okay, that is a 10 days. And what is the 8th day disease? The name for the 8th day disease, that is also caused by the tetanus, that is the neonatal tetanus seen in the infants, that is a neonatal tetanus, that is the 8th day disease. Okay, causes what, it causes the inhibition of the glycine and GABA, and these are the inhibitory neurotransmitter. So inhibition will be removed, and person will go into the spastic paralysis. Now what you can see here, you can see some membrane like this. This is also found in the Clostridium, that is the pseudomembrane colitis. कहाँ पे मिलता है? Clostridium difficile. ठीक है, and what is the aggravating factor for the Clostridium difficile pseudomembrane colitis is what, the third generation cephalosporin. This is what, third generation cephalosporin is the aggravating factor for the pseudomembrane colitis and or Clostridium difficile. Now this is what this is due to the, this is actually the floppy baby syndrome. Floppy baby syndrome. Okay, and it is mainly due to what? Canned food poisoning. और किसकी वजह से होता है? Clostridium botulism. That is a Clostridium botulism. canned food poisoning, and the floppy baby syndrome. Now, when we talk about the Clostridium botulism, the toxins are both toxins are what heat labile toxins, okay, and they inhibit what the acetylcholine release. If they inhibit the acetylcholine release, the baby will go into hypotonia and what floppy baby syndrome. This is what the floppy baby syndrome due to Clostridium botulism due to the inhibition of the acetylcholine causing the hypotonia. Okay, so next is we're talking about this filamentous like growth colony that is seen in the actinomyces, but some key differentiating features between the nocardia and the actinomyces is that key actinomyces is what an anaerobe, जबकि nocardia is what an aerobe, ठीक है, and is also an acid fast chain and show what the pulmonary infections and the drug of the choice we remembered by the SNAP. That is what the sulfonamides for the nocardia and penicillin for the actinomyces. But one important thing to remember is that the sun ray appearance and it is due to what the sulfur granules. It is due to what the sulfur granules that is that are being released by the actinomyces, so causing what the sun ray appearance. You can see this sun ray appearance that is due to the release of what the sulfur granules. Now this is again the nocardia and the actinomyces that we are talking about. Now this is the mucoid colonies, very characteristic mucoid colonies on the McConkey agar that you see in the capsule. Okay, very important that the mycoid colonies on the McConkey agar that is seen in the Klebsiella. Now, for that, we need to remember that McConkey agar is used for the differentiating of the lactose and non-lactose fermenters, है ना? And remember the mnemonic that is by the ships that is the Shigella, Yersinia, Proteus, and the Salmonella. These are what the non-lactose fermenters. And what is the mnemonic that we remembered for the concat is what? Plant. That is a peptone lactose agar. Neutral red is the indicator and the taurochole that is the bile salt that is the selective media. So McConkey agar is both the differential media as well as the selective media. Now one thing that we missed is about the listeria that the Anton test is positive in what? Anton test is positive in listeria. And listeria are also catalase positive just like staph. Okay? And cam test positive just like Streptococcus agalacti. Please remember, Anton test is shown by the listeria. It is also catalase positive and the cam test positive. Okay, so we were where? We were talking about the Klebsiella. Now, when we talk about the Klebsiella, we need to go into detail about the gram-negative bacilli first. Okay, so when we talk about the gram-negative bacilli, they are either what? Lactose fermenters or non-lactose fermenters. So lactose fermenters, non-lactose fermenters, we remember by the mnemonic that is the ships, that is the Shigella, Yersinia, Proteus and the Salmonella. And it may be the first two here. This will be H2S production negative and the H2S production positive. इसके अलावा one is that is the non-lactose fermenters, but oxidase positive is the pseudomonas. But all these are what the oxidase negative. So non-lactose fermenters by mnemonic ships, that is the Shigella, Yersinia, Proteus, Salmonella. इसमें starting के दो तो H2S negative है and last H2S positive. But the pseudomonas is also non-lactose fermenter but oxidase positive. ठीक है, अब इसमें अपन बात करते हैं लैक्टोज फर्मेंटर दैट आर द फास्ट एंड द स्लो लैक्टोज फर्मेंटर. ठीक है, now slow lactose fermenter one is the Shigella sone and the Serratia, and fast we are talking about the Klebsiella E. coli and the Enterobacter. So these are what? These are fast lactose fermenter, that's the Klebsiella E. coli and the Enterobacter. Now this is what this is. We are talking about the Klebsiella, and this is what rhinodermatosis that is shown by the Klebsiella. Right, and what are the two important cells that are present is one is the Roussel body and another is what the Miculus cell. ठीक है, प्लीज रिमेम्बर वेरी इंपॉर्टेंट वन इज द रूसेल बॉडी एंड द म्यूकुलस सेल. और म्यूकुलस सेल क्या होते हैं? कुछ नहीं होते, वैक्यूलेटेड सेल विद व्हाट एंड वैक्यूलेटेड फोम सेल विद द सेंट्रल न्यूक्लियस, दैट इज द वैक्यूलेटेड फोम सेल विद सेंट्रल न्यूक्लियस. ठीक है, these are what the muculic cell and the Roussel body that are seen in the rhinodermatosis, that is what caused by what the Klebsiella. Okay, so these are what you can see, these are the large vacuolated form cell with the central nucleus, that is what a muculic cell. Okay, now before coming to the this we need to also remember that Klebsiella is what? Gram negative, non-motile. Because what are the examples of all the Enterobacter are motile, but there is exception. That one is the Klebsiella and another is what? Shigella. Please remember it कि all the Enterobacter are motile except Klebsiella and the Shigella. So Klebsiella is what? Non-motile, and it is what? It is what? It is capsulated and urease positive. So how we remember the urease positive? It is what? Capsulated, urease positive, and we remembered by the mnemonic that is the punch is by urease positive, that is P for protease, P for proteus, urea plasma, nocardia, cryptococcus, this punch kiss, H for helicobacter, Klebsiella, saprophyticus, and epididymis. Okay, so these are what the urease positive, that is the punch kiss, proteus, uroplasma, nocardia, cryptococcus, helicobacter, Klebsiella, saprophyticus, and epididymis. Also, which subspecies of the Klebsiella will cause what? Atrophic rhinitis. This is what? This is Klebsiella oziana. Okay, remember it is Klebsiella oziana that will cause the atrophic rhinitis, and we have talked about the mycelic cell and the cell body that is seen in what the Klebsiella dermatosis. Now, this is what, this is very easy. This we can clearly see the swarming motility of what? Swarming motility of what? Swarming motility of Proteus. Okay. Now, it is a swarming motility of Proteus. Now, other than the Proteus, we remembered by the PVCS that they will also show the swarming motility. That is, one is the Proteus, another V is the Vibrio parahemolyticus. C for what? C is for what? Clostridium tetani and Serratia. Okay. So, Vibrio parahemolyticus, Clostridium tetani, and the Serratia. And we need to remember these also organisms also show what the swarming motility. And how it can be inhibited? It can be inhibited either by increasing the concentration of agar up to 6% or by the using McConkey media because it is having the bile that is inhibitory. Other than this, the similar to the McConkey media is a clad media. इसके अलावा ferrous ions, addition of the ferrous ions or Leifson's method. We talked about the Leifson's method where in the for the detection of what the motility for the flagella. Okay, because it consists of the sodium deoxycholate. Okay, so how we can inhibit by using the agar 6%, McConkey media, clad media, addition of the ferrous ions and the Leifson's method. Now, one more test that is important for the Proteus. Now, what is this? You can clearly see a difference of line between these two colony formation. इसको अपन क्या कहेंगे? इसको अपन कहेंगे Dines phenomena. क्या कहेंगे? Dines phenomena. और ये किस लिए यूज में आता है? To see the two substrains of what the Proteus, because it will show a clear line of differentiation when two different substrains of Proteus is grown on the same culture media, क्योंकि दोनों की swarming motility थोड़ी थोड़ी अलग होगी, so this will be a difference. So is nothing but the Dines phenomena of Proteus, that is two different strain of the Proteus. Now, one important point is to remember that Dines method is used to stain the mycoplasma, जबकि Dines phenomena is shown by Proteus. Proteus इसको represent करेगा और stain करेगा किसको? Mycoplasma. So, Dines method is used to stain mycoplasma. Now, this is a Weil-Felix reaction. We'll not read in detail about the Weil-Felix. This is also what with the OX1921K के strain हम use करते हैं Proteus का, so that they will react with the rickettsia antigen and we can actually help in the diagnosis of the rickets. Now we'll come to this. Now this is what this is. You can see the longitudinal and the horizontal ulcers. Okay, where the longitudinal ulcers are found and where the horizontal ulcers are found. Okay. So now we are talking about the cell molina, and please remember that in the typhoid, longitudinal ulcers are found, while you can clearly see these horizontal ulcers are found in the TB. Okay, जबकि longitudinal ulcers are found in the typhoid. Now, we do tend to get confused between the longitudinal and the horizontal this ulcer. So remember कि typhoid में T Y ऐसे है, P ऐसे है. So the line is going down like this. So longitudinal ulcer. Now horizontal ulcer will be in the TB. Now, what is another thing that is also found is the rose spots. That is the rose spots. You can clearly see rose spots is also seen in where typhoid. Now, what is the clinical test that is we remember by the mnemonic? That is the BASU, BASU. That is the first week, second week, third week, and fourth week. Okay. Now, first week we'll see the blood culture. Second is the agglutination reaction. That is what Vidal, and stool culture and urine culture. Okay. Stool culture is what it is the best for the lab diagnosis, and this is the sequence we need to remember by the pass. The first week at the blood agglutination reaction, Vidal, stool culture, and the urine test. Now, this is what this is again enrichment media. Okay, enrichment media that is selective for the what? Selective for the cell molecular, and what is it? It is selenite F growth. It is what? Selenite F growth that is used for what the cell molecular, and another is the tetrathionate growth. Selenite F growth is used for the growth of what the Salmonella and Shigella, and another enrichment media for the cell molecular is what the tetrathionate F growth. And what are the selective medias? Are the XLDs, okay, deoxycholate citrate agar, and is XLD. Now, selenite F growth, this is actually a enrichment media, because enrichment media क्या होता है? Liquid media होता है that inhibits the other microorganism and supports the growth of the selective organism that we need to study. That is what we are talking about, the cell molecular. Now, when we talk about the Shigella, before coming to this slide, when we talk about the Shigella, please remember Shigella is also a catalase positive. के अलावा अपनों ने ये देखा था कि कैटलिस्ट पॉजिटिव एक तो स्टैफ फाइलोकोकस था, ठीक है, एक तो स्टैफ था, एक लिस्टीरिया था, एंड वन वी आर टॉकिंग अबाउट द शिगिला. बट शिगिला dysentery is not catalase positive. So Shigella dysentery is not catalase positive. Now, one more thing that Shigella is what? Non-lactose fermenter. ठीक है, हमने शिप्स में निमोनिक पढ़ा था. But Shigella sone is what? Late lactose fermenter. So this is also an exception. Okay. Remember these two exceptions. One is a late lactose fermenter is Shigella sone, and catalase positive is what? Shigella, but exception is Shigella dysentery is catalase negative. Now we'll talk about the three pigments, that is the green, blue, red, and yellow colored pigment that are present in where? In the pseudomonas. और अपनों ने एक और चीज पढ़ी थी, pseudomonas is an obligate arrow, ठीक है. And what test were using for the Fimbri by using pseudomonas? It was what? The surface pellicle test. If you remember in the yesterday's class, it was surface pellicle test. It is also catalase positive and the oxidase positive. And what are the three pigments that is we are talking about? One is the pyocyanin, that is the blue-green pigment. Okay, pyorubin, that is the red-colored pigment, and the pyroviritin, that is the yellow color pigment. So easy to remember, pyorubin, that is a red color pigment, and how I remember the pyocyanin को cyanin खा लेता है तो pale blue something like the person goes into that state. This is how to easy to remember that pyocyanin for blue color, pyorubin for red, and बचा हुआ pyroviritin for the yellow color, right? Now, one thing we need to remember, this is again the same media, that is the pyocyanin, pyorubin, कि जो pseudomonas है, it also act by the protein synthesis inhibitor. Now, what are the other organisms that also act in the same way of the protein synthesis inhibitor? That is the factor elongation factor 2 inhibitor. That is one is the Shigella, another is the Pseudomonas, इसके अलावा Corynebacterium diphtheria, EH hemorrhagic E. coli, that is EHEC. Okay, so these four we need to remember on the tips. One is Pseudomonas, Corynebacterium diphtheria, Shigella, and EHEC. Right? And one more thing is that key selective media. What is the selective media for the Pseudomonas? It is the cetrimide agar. Is what? Cetrimide agar. Now, when we talk about the Pseudomonas malayi and Pseudomonas pseudomalayi, now Pseudomonas malayi will cause what? Glanders disease, and pseudomalayi will cause what? Melioidosis. This is what? White murray bacillus. Okay. So remember, malayi will cause glanders disease and pseudomalayi will cause the melioidosis. Now, we'll talk about the Vibrio cholera, that is a steam. You can see one is what that it is the comma shaped appearance of the Vibrio cholerae and Vibrio cholera में coin positive. What does the coin stands for? Catalase positive, oxidase positive, indole positive, and nitrate reduction positive. ठीक है इसके अलावा they will show what sucrose lysis. Okay, so that is a coin positive, catalase positive, oxidase positive, indole positive, and the nitrate reduction test that is positive. This is nothing but the TCBS. Very easy. TCBS पे yellow colored colony formation, and TCBS is what both differential and selective media. Okay, and Vibrio parahemolyticus will not show the growth because sucrose lysis is shown by the sucrose fermentation is shown by the Vibrio cholera. Now, one will talk about the safety pin appearance of the organism. जब अपन safety pin appearance can just remember the name of that is a Campylobacter. Another is the Pseudomonas will also show Pseudomonas malayi and the Pseudomalayi. They will also show the safety pin appearance. Vibrio parahemolyticus. It also show the swarming motility as well as a safety pin appearance. H. ducreyi. We will see in H. ducreyi the type of the appearance, railroad appearance, and the Yersinia. So these are some important list of the safety pin appearance of the Proteus motility, and you need to learn it by heart. Okay, so Campylobacter, Pseudomonas malayi, Pseudomalayi, and the Vibrio parahemolyticus, H. ducreyi, and the Yersinia. Now, one more important thing is that ki Kana-Gawa phenomena. When we talk about the Kana-Gawa phenomena, it is shown by what? Vibrio parahemolyticus. Now, before coming to this, Vibrio will show that is classification is what the classical and the L2. ठीक है तो क्लासिकल में मुखर्जी फेज 4 सस्पेक्टिबिलिटी इज प्रेजेंट जबकि यहाँ फेज 5 सस्पेक्टिबिलिटी इज प्रेजेंट इसके अलावा पॉलीमाइसिन B is sensitive while here it is resistant and here CAM is positive and chick embryo this chick embryo agglutination is present. ठीक है so remember this it is classical phase 4 Altor में you can remember it by this Altor consisting of the 5 spellings that is 1 2 3 4 5 so phase 5 and it is polymyxin resistant as well and camp and the chick embryo agglutination is present and motility we know that Vibrio will show what darting motility के अलावा darting motility और किसकी होती है that is the Campylobacter. And what is important to remember about the Campylobacter is what? Microaerophilic. क्योंकि इसको 5 to 10% ऑक्सीजन ही चाहिए। और दूसरा कौन सा ऑर्गेनिज्म है, दैट इज माइक्रो एरोफिल इज व्हाट, एच पाइलोरा। ठीक है, so Campylobacter is microaerophilic. Similarly, H. pylori and darting motility is shown by the Vibrio as well as the Campylobacter. And enrichment media हमको पता है, this is the TCBS, that is the selective and the differential media. What is the enrichment media? That is the alkaline peptone water, because alkaline nature of the media will inhibit the growth of other pathogens, but will support what, Vibrio cholera. Now, when we talk about the halophilic vibrio, ठीक है, that is they need what, they actually grow in more the salt concentration about 7.5%, more than 7.5%. So what is the example, is the vibrio parahemolyticus, vibrio vulnificus, vibrio alginolytic, ठीक है, parahemolyticus, vulnificus and alginolytic. This is a Kanagawa phenomena. Please remember, it is shown by what, the is shown by what? Vibrio parahemolyticus. That is a Kanagawa phenomena. Vibrio parahemolyticus, right? And one we need to remember, that is they will show what, the safety pin appearance. And we read about the other organism showing the safety pin appearance. And another is that the name of the media, that is on the Pagatsson blood agar. Right, and the hemolytic activity, the name is given, that is a Kanagawa phenomena on the Bagatsuma blood agar, and they will show what, the safety pin appearance. This is what, this is nothing but string test, that is Vibrio. For Vibrio we use, right, and we need to remember it is 0.5% sodium deoxycholate that we do in the emulsification. Just remember these two things. ठीक है, for the 5.5% sodium deoxycholate. Now, this is what, this is the railroad appearance or the tram track appearance या फिर school of fish appearance. All the three these appearance, that is one is what, the railroad appearance or the tram track appearance or the school of fish appearance is seen where, in the H influenza. ठीक है, H influenza, that is Haemophilus influenza. And what is the other name of the H influenza? It is Pfeiffer's bacilli. It is what? Pfeiffer's bacilli. And P for P, that it will cause the pink eye syndrome, that is the Cott's spear bacillus. And P for P, that it will cause what? Brazilian purpuric fever. Okay, so H influenza, that is first bacilli, P for P pink eye syndrome, P for Brazilian purpuric fever, and it is railroad appearance, tram track appearance, and school of fish appearance. Okay, now this is nothing but the chocolate agar. We have already seen that chocolate agar is the enriched media that we use for the H influenza. And what is the reason? It is due to the release of the factor number 5 by the lysis of the RBC. And chocolate agar is nothing but 5 to 10% of the sheep blood agar that is heated up to 70 degrees Celsius. Now, this is another important test, that is the satellite test. And where it is seen? Where it is seen? It is seen where? Again, the H influenza. Okay. And what is the reason? This is called as a satellite test. What is the reason? Is that Staphylococcus aureus will show the beta hemolysis. ठीक है। अगर स्टेफ ओरियस बीटा वर्सेस करेगा तो लाइसिस करेगा आरबीसी का ऑन द ब्लड अगार, ठीक है। लाइसिस करेगा तो दिस विल रिलीज द फैक्टर्स एंड दीज फैक्टर्स विल बी टेकन अप बाय व्हाट द एच इन्फ्लुएंजा एंड द nearest the growth will be maximum due to release of the numerous factors. So you can see as if the satellite is taking off, so it is satellite test, ठीक है। It is what as the satellite test that is seen in what H influenza and when the staphylococcus will show the beta hemolysis. So what is the important thing is written that this is visible by the naked eye, that this growth is visible by the naked eye, while this is not a visible growth. Although the growth is also taking here somewhat, but the growth is not visible. It is the nearest here and it is known as the satellite test. Now one is remember that brucella causes what? Malta fever. Causes what? Malta fever. Okay. And what is the blood culture media that we use is known as the Castaneda media. Castaneda media. Okay. Now the history will come ki after installation of the AC, the person is sick and something like this. That is, we are talking about Legionella. Okay. And transmission occurs through the AC plant. That is the aerosol transmission is taking place. Okay, in the Legionella. And what is the culture media? It is what BCYE, that is the buffered charcoal yeast extract. That is BCYE. BCYE for the growth of the Legionella and aerosol transmissions takes place after the AC implant. Also, it causes what the atypical pneumonia. And macrolides are the drug of choice. Now, this is what these are the condylarthria lata. These are seen where in the secondary syphilis. Okay, that is it. We'll talk about the spirochetes, trypanosoma pallidum. We'll talk about the primary, secondary, and tertiary syphilis. Primary में painless ulcer, पेनलेस शैंक्र और द अल्सर, ठीक है। सेकेंडरी में रैश होगा एक तो, और दूसरा भी नीड टू रिमेम्बर इज द कॉन्डोलाइमा लेटा। एंड थर्ड में टर्शरी में व्हाट वी सी द गमास, these are nothing but these are what the dead swollen fibrotic tissues, and we'll see what tabulus dorsalis and other complication of the aortitis. But remember the gamas and condylarthria later are where seen, while the these are what nothing but the gammas that is seen where in the tertiary syphilis, and they are the dead necrotic swollen fibrotic tissue. So again the corkscrew appearance of the Treponema pallidum in the dark ground microscopy, and this is under the fluorescent microscopy. Okay. This is the silver impregmentation test that is again done to see the motility of, that is the corkscrew motility seen that of the Treponema pallidum, and this is what the Fontana stain technique that we are using the silver impregmentation, that is the Fontana stain showing what the corkscrew motility. Now this is what we are talking about, the test that we are talking about, the side flocculation test, okay, that we do, that is a VTRL that we do for what the Treponema pallidum, or the for the syphilis we do the VDRL. Okay. Now you can see that these chambers are being created, and we'll see the weak reaction, strong reaction, or no reaction at all after the inoculation of antigen. We'll see the antigen antibody reaction. Now this is what this is. As I told you, these are the red color pigments. That is रेड कलर पिगमेंट, और उनका नाम क्या है? प्रोडिजियोसिन। ठीक है, दैट इज प्रोडिजियोसिन, and that is released by what? Serratia. But what is important to remember is that क्योंकि proteogesin will give the red color, and it will also give the red color to the sputum, and the person will present with the red color sputum, and he will think it is what? Hemoptysis. So this is what? Pseudo hemoptysis. Just remember this. Okay, that is the pseudo hemoptysis. Now this we are talking about what? Now actually we are talking about the Mycobacterium tuberculosis, and please remember the background will be blue with the pink or the purple colored colonies of the bacteria. Okay. Now this is again what? This is the fluorescent microscopy with the Mycobacterium tuberculosis showing the under the fluorescent microscopy. That is the stain we need to remember. It is the rhodamine auramine stain. It is the rhodamine auramine stain, that is because the dye binds with the mycolic acid and modified Zn staining that we are using, and in which we saw the background is blue and the bacteria with the purple and the pink colored. And remember the rhodamine auramine stain we are using for the fluorescence microscopy for the detection of the mycobacteria. But what does happen? कि जो rhodamine auramine stain है, this will bind with the mycolic acid that is specifically present in what? The mycobacteria. So remember the name of the stain, that is the rhodamine aurum. Now, this is what the ठीक है LJ media. The Lowenstein-Johnson's media, that the green color is due to the malachite green, and the colonies will show the rough, puff, and the tough colonies. Okay, and while the Microbacterium leprae will show the smooth colonies. Will show the smooth colonies. Now coming to this, it is what it is similar to that of the mercury drop. That is what it is, mercury drop colony. Seen where? Seen where? Seen in Bordetella pertussis. Okay, that is seen where? In the Bordetella pertussis, presenting with the mercury drop colonies. That is the mercury drop colonies. On the blood agar appear as small dome-like opaque grayish-white reflector glistening. So you can see that these small dome-like refractory and glistening growth on the blood agar, right? So they are known as the mercury drops. Seen where? In the Bordetella pertussis. Now, this is the chlamydia we are talking about, and these are the brown inclusion bodies. These are what? The brown inclusion bodies. These are brown inclusion bodies that are seen in the McCoy cell line in the chlamydia. On the growth on the McCoy cell lines showing the brown inclusion bodies. Now, this is very easy, but it is similar to that of the fried eggs. So it is what? It is nothing but fried egg colonies. Okay? And where it is seen? It is seen where? In the mycoplasma. And mycoplasma is what? Is the smallest free living organism. Okay? And it doesn't have the cell wall. It doesn't have what? The peptidoglycan. So peptidoglycan is what? Absent. And previously it was known as PPLO, that is pleuropneumonia-like organism. So PPLO is what? Pleuropneumonia-like organism. Fried egg colonies shown by the mycoplasma, and it is the smallest free living organism with no cell wall. Okay, one more thing, that Lyme's disease. Lyme's disease is caused by the Borrelia burgdorferi, ठीक है? That is Lyme's disease. And vector is what? Tick. All right. Okay, so all the images of the bacteriology, and this was completed in 2 sessions. And if you revise, you can watch it at 1.5 speed, so that it will help you to easily revise in a fast forward way. क्योंकि आज जो bacteriology का मैंने session लिया था, I covered all the important points of systemic bacteriology along with the key points. अगर मीडिया की फोटो नहीं है, मतलब जिस मीडिया की फोटोज नहीं पूछ जाती, द मीडिया आई ऑल्सो टोल्ड यू कि कौन सा मीडिया यूज करते हैं, व्हाट इज द डिजीज दैट इज कॉज. सो ऑल द पॉइंट्स वर कवर्ड अलोंग विद द इमेजेस. ठीक है. सो आई सी यू इन द नेक्स्ट सेशन एंड विल कवर अप द पैरासाइटोलॉजी इमेज. So tomorrow's exam, so I'll request you to have go through the images and the parasitology image. This video is present on the special class on the Unacademy app, and it is totally free. So you can go and watch the parasitology images there, because अगर मैं session लूँगी, I'll be probably taking tomorrow on the parasitology and exam तो कल ही. So for those who are clearing the exam tomorrow, can watch it from the special class, and please do use my code, that is Muskan 10, to log in the app. Even if you log in just the app, please use the code, because it just help us our for the review. So please use my code, that is Muskan 10. And today's session was very important, covering all the important images. ठीक है. एंड कल एग्जाम देने जाओ, अच्छे से सो के जाना. और अगर आज नहीं भी पढ़ो तो भी दैट इज टोटली फाइन. जस्ट कीप योर माइंड चिल, so that you can do the logical thinking examination, because that is most important. That is going to help you. कितना ही पढ़ लो, if you're panic, if you illogically mark the answers for thinking, if your mind is not calm, it will not be going to help you. एक आंसर गलत हो गया, अगला आंसर भी गलत हो जाएगा, thinking that the last was wrong, and your thinking ability will be hampered, right? So आज रिलैक्स करो, कल हल्का थोड़ा नाश्ता करके जाना और जल्दी सेंटर पे जाना. ठीक है. लास्ट मोमेंट तक don't read the books, because it will just puzzle out your mind. So all the best to everyone, and see you tomorrow. Let's see how the paper comes. Take care and bye bye. आज क्या है? फ्राइडे है, सैटरडे. or deep? Where do you think this career deep in those places? हेलो. हाँ हेलो. हाँ तो बेल बजा दो ना, कोई है नहीं क्या अंदर? कोई है नहीं तो फिर सामने वाले घर में दे दो और मेरी बात करा दो एक बार. हाँ, उनमें उनमें मेरी एक बार बात करा दो, ठीक है? हम्म. आ रही हूँ यार, अपडेट कर रही हूँ शीट, सर खा गया मेरा. मैं कोई टाइम पास थोड़ा ना कर रही हूँ. तो यार आप ऐसे बोल रहे हो, मैं क्लास लेके बैठी हूँ, अगर टेबल जब पे बैठी हूँ तो इट्स मीन दैट आई एम डूइंग समथिंग. मेरे को शौक है क्या एक्स्ट्रा बैठने का? रुक जाओ, आ रही हूँ। मत करो, काम कर रहे हो यार।